So in this video we will be discussing about the external auditory meatus, or external auditory canal, external auditory meatus or external auditory canal. Okay, auditory canal. The external auditory canal lies between the pinna and the tympanic membrane. Pinna and tympanic membrane. Okay, this is tympanic membrane, this is outer pinna, and this is a canal, that is the external auditory canal. Length of the external auditory canal is 24 mm. Length of the external auditory canal is 24 mm. We may be confused sometimes with the length of the Eustachian tube. Okay, length of the Eustachian tube. Okay, the length of the Eustachian tube is 36 mm. You should know it, 36 mm. Length of the external auditory canal is 24 mm. The length of the Eustachian tube is 36 mm. Parts. Okay, external auditory canal. The outer 1/3 part is cartilaginous. Outer 1/3 part is cartilaginous, and inner 2/3 is bony. Whereas in the Eustachian tube, the opposite occurs. Okay, that is, we have mnemonics ICE 2/3. ICE 2/3 means inner cartilaginous part in Eustachian tube. Eustachian tube is 2/3. That means in Eustachian tube, the outer part is the inner part is cartilaginous. Okay, inner part is cartilaginous, and which is 2/3. Whereas in the external auditory canal, 1/3 cartilaginous part is only 1/3, whereas in the external auditory in the Eustachian tube, the cartilaginous part is 2/3. So outer 1/3 is cartilaginous and inner 2/3 is bony in the external auditory canal. And the shape of the external auditory canal is ear-shaped, curved. Okay. The cartilaginous part. Now let us discuss about the cartilaginous part. Okay. Cartilaginous part of the external auditory canal is outer 1/3. Okay. In the cartilaginous part, we have a fissure known as fissure of Santorini. Okay. We sometimes can be confused where the fissure of Santorini lies. So yes for Santorini, yes for side. That means in the outer part. Side, that means outer part. Outer part means side. Okay. Fissure of Santorini is present in side. That means in the outer part, fissure of Santorini is present. So in the cartilaginous part, we have fissure of Santorini. Through the fissure of Santorini, the infections can travel to and fro towards the parotid gland. Okay, that means the infections of the parotid gland can travel through the fissure of Santorini to the cartilaginous part of the external auditory canal, and from the external auditory canal to the parotid gland. The cartilaginous part, let us compare it with the bony part. Okay, bony part has the fissure of the foramen of Huske. The cartilaginous part has fissure of Santorini as per side in the outer part, whereas the bony part has foramen of Huske. Okay, this is mostly present in the children less than 4 years, and through the foramen of Huske also, the infections can travel to and fro from the parotid gland and the temporomandibular joint. Okay, so foramen of Huske is present in the bony part, whereas the fissure of Santorini is present in the ears per side, that is the outer cartilaginous part. Okay, in the cartilaginous part, we have ears, and we have here pilosebaceous glands, and ceruminous glands, but these are absent in the bony part. So in the cartilaginous part, the ceruminous glands, pilosebaceous glands will secrete the wax. So wax is present. Wax is mainly secreted by the outer part. Okay, outer cartilaginous part. And the ceruminous gland, it is a modified apocrine gland. Apocrine sweat gland. Okay. In our body, the sweat glands are of two types. Okay. One is eccrine, that is the typical sweat glands, eccrine or typical sweat glands, and apocrine or atypical sweat glands. A for apocrine, A for atypical sweat glands. Okay. The typical sweat glands or the eccrine glands are present throughout the body. That is distributed throughout the body. Okay. They open on the skin surface. Okay. All the sweat that comes in our body is through the eccrine glands. They are present throughout the body. But the apocrine or atypical glands are present distributed in some parts of the body. And they do not open on the skin. They open on the skin surface. They open into hair follicles. Okay. And typical sweat glands are innervated by cholinergic nerve fibers, whereas the atypical or apocrine glands are innervated by the adrenergic fibers, adrenergic nerves. Okay. These apocrine glands or the modified sweat glands are present in axilla, mons pubis, circumanal area, okay, areola, nipple. Okay. So we should remember the fact that the sweat glands, that is the present in external auditory canal, is apocrine gland or modified sweat gland. It is a type of modified sweat gland. Okay. And since the hair follicles are present only on the outer cartilaginous part, so the infection of the hair follicles by staphylococcal infections, that is the furuncles are only seen in the outer cartilaginous part. Okay, they are not seen in the inner bony part. And we should also remember that in the cartilaginous part, the skin is thick. Okay, whereas in the bony part, the skin is thin. We can remember it by that since the cartilage is weak, so skin is thick. Okay, bone is hard, so the skin is thin. So this we can remember it by that the skin is thick to compensate for the weaker cartilage, and bone is, and in the inner part the bone is already strong, so the skin is thin. Okay, so in the cartilaginous part, the skin is thick. In the bony part, the skin is thin. Okay, so we have the outer part, outer one third means 1/3 of 24 mm, that means 8. Okay, whereas 2/3 means 16 mm. Okay, inner 2/3 is 16 mm. In the inner bony part, 5 mm lateral to the tympanic membrane. This is the tympanic membrane. Okay, and this is the external auditory canal. And 5 5 mm, about 5 mm lateral to the tympanic membrane, there is a narrow part. Okay, this narrow part is known as isthmus. What is the clinical importance of the isthmus is that if any foreign body get lost medial to the isthmus, then it is very difficult to remove, since it is a narrow part, so it is very difficult to remove. Okay, and in the anterior-inferior part, this is called anterior recess. Okay, the clinical importance of anterior recess is that any discharge from the middle ear is collected in the anterior recess. Okay, so while cleaning the ear, we should especially focus on the anterior recess, because the discharges may be missed out from the anterior recess. Okay, now coming to the blood supply, the auricle was supplied by the perichondrium because it was a avascular structure, whereas the external auditory canal is supplied by external carotid artery. Okay, the lymphatic drainage of the external auditory canal is same as that of the auricle. We have already discussed the lymphatic drainage of the auricle in the video of auricle. So the lymphatic drainage is same as that of the auricle. Okay, knob supply. Okay, now let us recall the knob supply of the auricle. The auricle was supplied on the lateral surface and the medial surface. On the lateral surface, it was supplied by the auriculotemporal nerve, greater auricular nerve, and auricular branch of the vagus nerve, that is called Arnold's nerve, and the facial nerve. While in the medial surface, it is supplied by the lesser occipital nerve, greater auricular nerve, and the branches from the vagus and the facial nerve. Okay, whereas the external auditory canal is supplied primarily by 3 nerves. Okay, let us suppose this is an external auditory canal passage. Okay, it is a passage going from the pinna to the tympanic membrane, Okay, it is a passage going from the pinna to the tympanic membrane. So it has 4 surfaces. Okay, this is the anterior part, anteriormost part. Okay, this is the posterior part. Okay, this upper one is the roof, and this is the floor. Okay, the knob supply of the external auditory canal on the anterior part and on the roof, that means on the anterior part and on the roof. Anterior wall and the roof is supplied by auriculotemporal nerve. Okay, the same nerve which was supplying this part of our pinna. Okay, this part of our pinna, the same nerve which was supplying this part of our pinna, auriculotemporal nerve, same nerve. Okay, auriculotemporal nerve supplies the upper part, that is the roof, and the anterior part, whereas the posterior part, posterior wall and the floor, whereas the posterior wall and the floor is supplied by auricular branch of vagus nerve, auricular branch of vagus, that is known as Arnold's nerve. Okay. The posterior wall also receives the nerve supply from the facial nerve via vagus. Okay. The posterior wall also receives the vagal nerve supply. What is the clinical importance of this? That if there is a facial nerve injury, okay, this will lead to the hyposthesia. That means sensation will be lost from the posterior wall of the external auditory canal, and this is known as Hichelberger's sign. So the anterior and the roof is supplied by the auricular temporal nerve, which is a mandibular branch of the trigeminal nerve, posterior wall, and the floor is supplied by the auricular branch of the vagus nerve, which is also known as Arnold's nerve, and the posterior wall also receives the innervation from the facial nerve via the vagus nerve. Okay, and if there is a facial nerve injury, there will be the hyposthesia of the posterior wall of the external auditory canal, and this is known as Hichelberger's sign. Okay, let us discuss some of the difference in the external auditory canal of adult and the newborns. In case of the newborns, the external auditory canal is shorter. That means in the adults it was 24 mm, whereas in the newborns it is only 20 mm. Okay. Second is in the newborns the bony part, that is the inner part of the external auditory canal is absent. The bony part of the external auditory canal is absent. Cartilaginous part is only present, and the bony part is present, but the bony part of the external auditory canal is absent. Okay. And the cough reflex, which can occur while cleansing the ear, it is mediated via the vagus nerve, because the vagus nerve which supplies the posterior wall, and the inferior wall. Okay, this vagus nerve, which is a branch of the auricular branch of the vagus nerve, also known as Arnold's nerve, also supplies the pharynx, and the respiratory mucosa in the pharynx. So through the vagus nerve, the cough reflex is mediated by the vagus nerve. Okay, while cleaning the ear. Thank you.